rather than diabetes management, you can tailor that. So if they're on tirzepatide 12.5 and they have met that goal and they're still losing weight, you could back to tirzepatide 10 and then tirzepatide 7.5 to maintain that weight loss. He's bringing the microphone to you.
In type 2 diabetics who are on a combination insulin with a GLP-1, A1C reduction, and have them on a plain long-acting insulin and a GLP-1 like Ozempic. Like, for example, Soliqua has both.
Mm-hmm.
Would they get a better management if they would be on Lantus and Ozempic?
Potentially, because of the greater benefit of weight loss with semaglutide and tirzepatide as opposed to the exenatide that's in the combination.
Anybody else? All right. Thanks, Dana. We'll take about a 10-minute break, and then we'll start. And stay that way. Dr. Caitlin Van is our. She graduated from LMU Dcom in 2016, a family medicine residency with a sports medicine fellowship at East Carolina University before returning home to the state of Georgia. She now works for Northeast Georgia Physicians Group in Cleveland, Georgia, where she practices family medicine. Please help me welcome Dr. Van.
All right. Hello. So when I got asked to do this, I went over to my colleagues because I work at a family medicine office, and I was like, okay, give me a sports medicine topic that y'all want to hear about. And they said concussion. And I said, absolutely not. Next one. And the next person said concussion. So I guess we're going to talk about concussion today. And obviously, it's a really complicated thing. I'm going to try to simplify it a little bit as best as I can, but we'll get through it together. So. All right, I have no disclosures. Objectives, you can read this on your own. I'm going to try to give you some tools to help you diagnose concussion, some tools to help with management of concussion, and be able to help educate your patients. So this is a busy slide, but what is concussion? I put two different definitions from different organizations on here. So the American Medical Society for Sports Medicine, in their position statement, defined a concussion as a traumatically induced transient disturbance of brain function that involves a complex pathophysiological process. And then the Amsterdam Concussion in Sport, their position statement defined it as a traumatic brain injury caused by a direct blow to the head, neck, or body, resulting in an impulsive force being transmitted to the brain that occurs in sports and exercise-related activities. This then initiates a neurotransmitter and metabolic cascade with possible axonal injury, blood flow change, and inflammation affecting the brain. So really simple, right? All right, the diagnosis is about as simple as the definitions. Unfortunately, there's a lack of validated, objective diagnostic tests for this. And so a lot of times we rely on these subjective, confounding, self-reported, nonspecific symptoms, which makes it really difficult. So what are some ways that we can do this? Obviously, we're going to start with your normal history and neuro exam. So when someone comes in with a history of some kind of head injury, I'm always asking, what's the mechanism of injury? How did it happen? And then what were your symptoms at that point in time? And then how have your symptoms continued to change over time? So what symptoms did you have immediately? What symptoms are you having now? There's neurocognitive functioning, so those are computerized testing. Some people have access to that, some people don't. Some people's high schools do it for everyone, some people don't. So that's a very nice thing if you have it, but not absolutely necessary. Concussions can cause some sleep disturbances. So are they getting up in the middle of the night? Are they taking naps during the day? These are all questions about sleep that you might want to ask your patients. And then we're going to get into kind of the rest of this. So your ocular function, your vestibular function, your gait balance, cervical skin exam, these should all be parts of your history and physical that you're doing. Of note, the FDA recently approved a couple tests, the glial fibrillary acidic protein and the ubiquitin carboxy terminal hydrolase L1. These have no role in our diagnosis at this point in time, but I guess keep on the lookout in case they change these recommendations. So the clinical evaluation, we use the sideline concussion assessment tool. This is mostly on the sideline, so then they made sport concussion assessment tool, mostly done on the sideline. So they made the sport concussion office assessment tool. Currently in the 6th edition. I'm going to kind of go through all of this, but the symptom checklist, a mental health screening, neurocognitive test, again, that's your computerized testing, cervical spine evaluation, and then VOMS and BEST are going to be talked about as well. All right, so I know this is really small, but this is the SCOAT symptom checklist. And so the SCOAT is a free online material, so you can look it up, but these are 23 different symptoms ranging from like headache, fatigue, confusion, and they rate them on a scale of 0 to 6. So when a patient comes in, my clinical staff will go in with the symptom checklist and kind of go through it with them, and then bring that checklist out to me. And so you get 2 scores from this. You get a basic symptom score, so 0 out of 23 or 6 out of 23. And then you get a symptom severity score, which is the total possible points. So 23 times 6 is 138. So what's their severity score based off of a score of 138? And my staff asks each time they come in, each time patients come in, they go over the symptom checklist again. So you're able to see kind of how they're improving in their symptoms, both overall symptoms as well as that severity. The SCOTE also has impaired memory. So obviously those are your same basic questions, like remember these 3 words and then come back to them later. Digits backwards. So if I were to say like 2, 1, 3, they would respond back 3, 1, 2. And then the months in reverse order. So these are all kind of your basic memory recall questions that are assessed. Your physical exam should include a cervical spine exam. So this is actually positive, and up to 68% will experience some kind of dysfunction. So don't forget about this when you're evaluating a concussion. Your neurologic exam, your balance, your gait, and vestibular ocular motion sensitivity, which again, this is all going to be explained further in the upcoming slides. All right, so the best is the balance error. Now I'm forgetting the S's. Scoring system, sorry. Balance error scoring system. And so it's done with 3 different stances. You do it 20 seconds each. The first time they go around on a firm surface and go around on a foam surface. And then you count all the errors. So they are going to start with their double leg stance, which the next slide will have kind of a picture of this, but both feet on the ground next to each other. And an error is defined as opening their eyes